Thank you for the introduction, and I would like to take a moment to thank ICAM for the opportunity to discuss our pilot One Health Companion Animal Management Program in Nauru. My name is Dr. Jessica Hoops, and I'm the One Health Research Coordinator for the National Australian not-for-profit organisation Animal Management in Rural and Remote Indigenous Communities, also known as AMRRIC. To start us off, I will hand over to my co-presenter, Ms. Amy Tsitsi, from the Nauru Department of Justice and Border Control Quarantine Division.
Companion animal overpopulation is a complex global issue associated with the establishment of large free-roaming dog and cat populations. Although management of these populations is often siloed within animal health and overshadowed by competing public health priorities, free-roaming cats and dogs can have far-reaching consequences for the health of people, animals, and their shared environment. These consequences are particularly significant in underserved areas with limited veterinary infrastructure, where the drivers and effects of free roaming companion animals are closely linked to social, ecological, and public health challenges. Addressing free roaming dog and cat populations and their associated impacts requires an integrated, multidisciplinary One Health approach to identify local priorities, understand the root causes of overpopulation, and support targeted, evidence based interventions to reduce negative impacts on people, animals, and local ecosystems. These challenges are particularly relevant in the South Pacific region, where free roaming dog and cat populations are common across many island nations and territories. The Pacific is geographically dispersed with substantial variation in population size, land area, governance structures, and historical relationships with other nations, including long-standing political, economic, cultural, and development ties. Across the region, cultural and religious beliefs, community relationships with companion animals, and variable access to animal health resources may influence how cats and dogs are managed. These factors also shape community perceptions of animal welfare and engagement with animal management and disease prevention initiatives. In many Pacific islands, geographic isolation, limited local resources, and small populations constrain the development and sustainability of veterinary infrastructure and workforce capacity. As a result, access to routine veterinary services is often limited or concentrated in urban centers, with many nations relying on visiting veterinary teams and external support. These interconnected social, environmental, and animal health factors contribute to substantial variability in the implementation and effectiveness of companion animal management programs across the region, reinforcing the need for locally adapted, collaborative, and culturally responsive approaches to companion animal management. Within this broader Pacific context, Nauru is one of the world's smallest island nations, with a land area of 21 square kilometers and a population of approximately 12,000. This creates a highly interconnected human-animal environment interface where changes in companion animal populations can have immediate and visible effects on the local community. Dog management in Nauru has a long and complex history, with contemporary concerns centered around dog attacks and motor vehicle accidents. Legislative recognition of dog management dates back to the Animals Act 1982, and animal management responsibilities have evolved within government over time. However, the absence of permanent veterinary services, together with limited companion animal health infrastructure and workforce capacity, has limited the effectiveness and sustainability of dog management efforts. Historically, dog population management has relied heavily on lethal control measures, including trapping, poisoning, and shooting. Following reports of a fatal dog attack in 2013 involving a young child, there was increased emphasis on structured dog management approaches, including veterinary outreach and desexing programs delivered in 2018 and 2019. Before service continuity was disrupted by the COVID-19 pandemic. In 2022, Animal Management in Rural and Remote Indigenous Communities, AMRRIC, was approached by the Australian Government Department of Foreign Affairs and Trade at the request of the Government of Nauru to support local dog population management activities. This presentation examines the resulting 2.5-year pilot One Health Companion Animal Management Program in Nauru, implemented between August 2023 and February 2026. The program was delivered over 9 visits and was designed to integrate animal health delivery with community engagement, education, and evidence generation to strengthen existing systems to support sustainable long-term changes in companion animal populations. The program is centered around 4 integrated components: community engagement and consultation, outreach veterinary services, school-based education and training, embedded research and monitoring activities. Ongoing community and stakeholder engagement form the central components of the program, with consultation activities conducted at each visit to identify local priorities, support collaborative program development, and communicate program and research outputs. Stakeholders included representatives from the human, animal, and environmental sectors, as well as district leaders and community members. Importantly, these activities supported stakeholders in recognizing connections between previously siloed agencies on issues relating to dogs and cats, strengthening understanding of One Health interconnections. This also helped identify gaps in the existing knowledge base regarding cross-sectoral impacts of companion animal populations and clarified how management responsibilities intersect across government and community stakeholders, thereby supporting the identification of shared priorities. Ongoing consultation also supported the development of a transition plan to decrease reliance on the use of 1080 and contributed to the development of a 10-year companion animal management strategy informed by broad stakeholder perspectives. These processes established the foundation for adaptive program design and long-term planning.
Outreach veterinary services were delivered in 7 locations across the island and primarily focused on reproductive control and preventative treatments, including vaccination, deworming, and external parasite prevention. In light of ongoing baiting programs being independently undertaken by relevant authorities targeting free-roaming dog populations, veterinary services were limited in this instance to owned animals. Across the program, more than 800 animals were desexed, including about 434 dogs and 408 cats. We also gave over 6,700 doses of parasite treatment, and 756 vaccinations were provided to participating animals. Although dogs were the original focus of the program, increasing cat numbers across the island were accompanied by growing demand for feline services, leading to a shift in caseload distribution over time that reflected changing community needs and priorities during implementation. Local staff supported the outreach programs, enabling capacity development in animal handling, surgical preparation, and perioperative monitoring of cats and dogs undergoing surgical desexing procedures. In the context of limited resident veterinary services, stakeholder identified priorities also highlighted the need for veterinary support for local farming activities, which was subsequently incorporated into the spectrum of service delivery. This highlights the importance of adaptive program delivery and demonstrates how ongoing engagement and service provision can help to identify evolving local priorities and emerging animal management concerns. School-based education aimed to strengthen community awareness and support long-term behavior change in companion animal management. 4 tailored lesson plans were delivered based on research outputs, stakeholder engagement activities, and feedback from local schools, covering topics including safety around dogs, dogs' needs and feelings, cat breeding, and worms and germs, which included a discussion of basic hygiene. Across the 4 visits that had education, the total attendance was over 3,000 primary school students in years 1 to 5 across 3 schools and 131 classes. Education lessons were co-delivered with local staff, supporting capacity building and increasing the potential for continuity of the education programs beyond the pilot. Activities were delivered through classroom-based lessons, providing an opportunity to promote safe interactions with animals, improve understanding of companion animal health and welfare, and support broader community engagement with the program. These activities also provided a consistent mechanism for community engagement and feedback across program visits. Research and monitoring activities were embedded throughout the program to establish baseline data on public health risks, dog and cat ownership practices, companion animal populations, and local knowledge and attitudes towards dogs and cats, while supporting program evaluation and adaptive implementation. Research activities were co-developed with local stakeholders to ensure alignment with locally identified priorities. Research activities included exploratory investigations of zoonotic diseases in cats and dogs, a retrospective evaluation of dog bite incidents in people, household surveys evaluating the size and demographics of the owned dog and cat population, as well as community knowledge and attitudes towards dogs and their management. Street surveys were used to monitor the free-roaming dog population, and assessments comparing local expert and community perspectives on dog management activities were also conducted. Additional scoping reviews were also used to explore potential public health and environmental considerations associated with companion animal management interventions. By embedding research within operational activities, we were able to generate locally relevant evidence to support future planning, resource prioritization, and inform recommendations for long-term strategy development based on local needs. With the veterinary program focused on owned animals, and our research estimating approximately 3,000 to 5,000 owned cats and another 3,000 to 5,000 owned dogs in Nauru, the scale and duration of the interventions limited the capacity to achieve measurable long-term changes in the local cat and dog populations. But besides this, the program generated several important operational and strategic insights. One of the program's greatest strengths was its ability to facilitate collaboration between government stakeholders, industry professionals, veterinary teams, and community members across multiple sectors. The program also improved understanding of the local drivers of free-roaming dog population, including behavioral, environmental, and structural factors shaping both population dynamics and community perceptions on the dogs. Ongoing consultation demonstrated that local priorities evolved over time, with increasing recognition of the importance of managing growing cat populations in the country. This shift in focus was directly captured through consultation, patterns of service delivery, and stakeholder feedback mechanisms. The involvement of community members and diverse government and operational stakeholders helped improve awareness of companion animal management activities and enabled the flow of community and broader stakeholder perspectives to government authorities. This process helped to bridge gaps between local priorities and existing intervention strategies, informing transition planning away from the use of 1080 and the development of a 10-year companion animal management strategy for Nauru, which balanced local needs and priorities across stakeholders, reinforcing the importance of a collaborative program design. Beyond the immediate companion animal management outputs, the program also generated broader One Health insights. The program highlighted the interconnected nature of human, animal, and environmental health challenges within small island settings, and demonstrated the importance of cross-sectoral collaboration in addressing these complex community issues. The program itself also served as a platform for identifying broader governance, health, and research priorities extending beyond the companion animal populations alone. For example, public environmental concerns around the use of 1080 have been raised, and local stakeholders have identified follow-up research priorities across sectors arising from the research that was done during this study. This included an improved understanding of system-level barriers and opportunities to strengthen locally relevant approaches to health and well-being, considering both the upstream drivers and downstream impacts of companion animal populations and their management. Some of the key lessons learned from our involvement with this program is that locally grounded and culturally responsive engagement was essential for informing recommendations for interventions that were both acceptable to the community and focused on their needs. Broader stakeholder collaboration was also essential for understanding the wider impacts of companion animal management activities and adapting to changing priorities over time. By embedding research and monitoring within the operational program, this supported evidence-informed decision-making and strengthened the capacity to prioritize limited resources based on changing needs. The program reinforced that sustainable change is unlikely to be achieved through short-term external service delivery alone and requires ongoing investment in local capacity, partnerships, and governance structures. This pilot demonstrated that free-roaming companion animal populations represent not only an animal management challenge, but a broader One Health issue requiring integrated and context-specific responses. Beyond addressing the immediate impacts associated with free-roaming dogs and cats, holistic One Health approaches offer valuable opportunities to foster cross-sectoral collaboration, to identify broader health and research priorities at the human-animal-environment interface, and to generate insights that extend well beyond companion animal management. As such, integrated companion animal management programs may function not only as intervention strategies, but also as mechanisms for strengthening One Health systems, partnerships, and locally informed approaches to health and well-being, both in Nauru and in the broader Pacific. We thank you for giving us the opportunity to discuss our pilot program and open the floor to questions.